Heavy vaginal discharge. Main causes. Regular vaginal discharge is a sign of a healthy female reproductive system. Normal vaginal discharge contains a mixture of cervical mucus, vaginal fluid, dead cells, and bacteria. Females may experience heavy vaginal discharge from arousal or during ovulation. However, excessive vaginal discharge that smells bad or looks unusual can indicate an underlying condition. Arousal. Sexual arousal triggers several physical responses in the body. Arousal increases blood flow in the genitals. As a result, the blood vessels enlarge, which pushes fluid to the surface of the vaginal walls. Arousal fluid is clear and watery with a slippery texture. This fluid helps lubricate the vagina during sex. Other signs of female arousal include increased heart rate and breathing, flushing of the face, neck and chest, swelling of the breasts, erect nipples. Ovulation. Cervical fluid is a gel-like liquid that contains proteins, carbohydrates and amino acids. The texture and amount of cervical fluid both change throughout a female's menstrual cycle. For example, after menstruation, cervical fluid has a thick mucus-like texture. It can be cloudy, white or yellow. Estrogen levels increase closer to ovulation. This causes the cervical fluid to become clear and slippery, similar to that of raw egg whites. Cervical fluid discharge increases during the days leading up to ovulation and decreases after ovulation. Females may have no discharge for a few days after their period. Hormonal imbalances. Hormonal imbalances related to stress, diet, or underlying medical conditions can cause heavier vaginal discharge. Polycystic ovary syndrome or PCOS, for example, refers to a set of symptoms that occurs as a result of hormonal imbalances. According to the Centers for Disease Control and Prevention (CDC), PCOS affects up to 5 million females in the United States. Those with PCOS have higher levels of male hormones called androgens. Increased androgen levels can change the amount or texture of cervical fluid, cause irregular periods, prevent ovulation. Not everyone with PCOS will have increased vaginal discharge. Paying attention to other PCOS symptoms may help someone identify and seek treatment for the condition faster. Some other symptoms of PCOS to look out for include fewer than 8 periods in 1 year or periods that occur every roughly 21 days, excess facial and body hair, thinning hair or hair loss, acne on the face and body, weight gain, darkening of the skin on the neck, groin and breasts, skin tags on the armpits or neck. Hormonal birth control such as birth control pills and intrauterine devices can also cause increased vaginal discharge, especially during the first few months of use. Excess vaginal discharge and other symptoms such as spotting and cramping usually resolve once the body adjusts to the hormonal birth control. Vaginitis. Vaginitis refers to inflammation of the vagina, which can occur from an infection or irritation due to factors such as douches, lubricants, and ill-fitting clothing. Vaginitis can cause thick vaginal discharge that may be white, gray, yellow, or green. Other symptoms of vaginitis include foul vaginal odor, an itching or burning sensation in the genital area, redness or inflammation of the vagina, pain or discomfort when urinating, pain during sexual intercourse. Bacterial vaginosis. Bacterial vaginosis is a condition that results from an overgrowth of bacteria in the vagina. This vaginal infection is the most common among females aged 15 to 44 years. The exact cause of bacterial vaginosis remains unclear. Females can develop bacterial vaginosis after sexual intercourse. However, this condition is not a sexually transmitted infection or STI. According to the Office on Women's Health, those who have bacterial vaginosis may notice a milky or grey-colored vaginal discharge. Some also report a strong fishy vaginal odor, especially after sexual intercourse. Bacterial vaginosis can also cause discomfort when urinating, painful burning or itching in the vagina, irritation of the skin around the vagina. Yeast infection. Vaginal yeast infections result from an overgrowth of the Candida fungus. Females of all ages can develop a vaginal yeast infection, and nearly 70% will have a yeast infection at some point in their lives. The most common symptom of a vaginal yeast infection is an intense itching in the vagina and vulva. Vaginal yeast infections can also cause an odorless vaginal discharge that looks similar to cottage cheese. Vaginal yeast infections are treatable at home using over-the-counter antifungal ointments. Symptoms should improve within a few days. However, severe infections can last longer and may require medical treatment. Trichomoniasis. Trichomoniasis is an STI caused by a parasite. Females can develop trichomoniasis after having sex with someone who has the parasite. Although most people who have trichomoniasis do not experience symptoms, some may have an itching or burning sensation in the genital area. Trichomoniasis infections can also cause excess vaginal discharge that has a foul or fishy odor and a white, yellow or green color. It may also be thinner than usual. What is healthy discharge? Healthy vaginal discharge varies from person to person. It also changes throughout their menstrual cycle. In general, healthy vaginal discharge can appear thin and watery or thick and cloudy. Clear white or off-white vaginal discharge is also perfectly normal. Some females may have brown, red or black vaginal discharge at the end of their menstrual periods if their vaginal discharge still contains blood from the uterus. Natural hormonal changes during ovulation can cause an increase in vaginal discharge, which should return to normal after ovulation. When to see a doctor? It is not always necessary to see a doctor about excessive vaginal discharge. However, a female may want to consider seeing their doctor if their vaginal discharge has an abnormal appearance. Yellow, green, grey or foul smelling vaginal discharge could indicate an infection. Other reasons to see a doctor include itching or burning near the genitals, discomfort or pain when urinating, discomfort or pain during sexual intercourse.